common problem a male faces is what we call as erectile dysfunction, or inability to sustain a good erection, or sometimes losing an erection during a sexual act, or sometimes having premature ejaculation. Now, all these can be frustrating because it affects the family life, it destroys the mental peace, and can cause severe psychological and also interpersonal relationship problems. Now, the good news is both erection hardness difficulty and losing erection, which we call erectile dysfunction, can be very easily treated. We have better diagnostic tools where we assess what is the reason this male is losing an erection. We do what is known as a vascular study of the penis, where we check the amount of blood flow, because ideally the blood coming into the penis creates the rigid penis. So we assess the amount of blood flow and compare it with the normal population and decide how much is the reduction. We also assess the oxygenation, because the blood flow is important. At the same time, nitric oxide, which is a mediator, releases oxygen, and for that you require normal endothelium. So we assess the penile endothelium and we decide which is at fault. Is it the vascularity or is it the endothelium? Once we know this, that this is at fault, then the advantage in this is it's a completely reversible process, where we use in some individuals medication, in some individuals exercises, and now we also have a revolutionary therapy which is called as penile shockwave therapy, which is also called as erectile dysfunction shockwave therapy, which involves giving externally to the penis shock waves which are not painful, which are not harmful, which hardly takes 5 to 10 minutes to administer. These are ultrasonic waves. They don't create shock. What they do is they penetrate the penis tissue, and as I said, the problem will be in the blood flow or in the endothelium. It helps regenerate or provide new blood vessels inside the penis, or regenerate the endothelium, which improves the nitric oxide. These sessions are administered in some cases on a daily basis, in some cases on a weekly basis, for a period of 4 to 6 weeks. Generally, we administer 8 to 12 sessions, and the reversibility happens in about 80 to 85% of individuals over a period of 3 to 6 months, which makes the individual go back to normal erections. And that is highly advantageous, especially for people with diabetes who have erection problems. We have people with hypertension or BP, which again causes erection problem. People also have obesity, or people who have cholesterol issues. All these men will benefit from this kind of a treatment. The other frustrating problem which men face is premature ejaculation, which is called rapid ejaculation. What is premature ejaculation? Is there a time for an ejaculation? Essentially, an ejaculation is called premature when your partner is dissatisfied and you ejaculate much earlier than your partner demands. There are people who ejaculate before penetration. There are people who ejaculate immediately after penetration. There are people who ejaculate after a couple of minutes of sexual activity. As long as the couple are dissatisfied with the timing of the ejaculation, we call all of this as premature ejaculation. And all these premature ejaculation problems, either we call it biogenic, which means that the penis is extremely sensitive, or structurally slightly abnormal because of the foreskin or frenular issues, or it is neurogenic, where it is extremely, the neurotransmitter release which is necessary to control ejaculation happens very fast in these individuals. Thank you.